Hello, colleagues. My name is Elizabeth Montgomery. I'm the Vice Chair of Anatomic Pathology at the University of Miami. I've only been here since July 2020, but the purpose of this video is to talk about something else, and that's Innovative Science Press. This is a very innovative press founded by myself and two colleagues, Magdalena Silva and Merlinda Caton, in 2017 when we published our first survival guide. Because I do gastrointestinal pathology, it was a gastrointestinal pathology survival guide. We've since published lots of survival guides, and the objective of these survival guides is to help a pathologist go from very little knowledge to a decent amount of knowledge in a short span. You can read the book on a plane, well, once the world is flying again, and really get an idea. So for example, I've signed out only gastrointestinal pathology and soft tissue pathology for many years. What if I had to tomorrow do prostate? Well, the survival guide by Andres Matoso and Jonathan Epstein would whip me right into shape. And I know this because I've gone through it in the editing process. So my co-founders actually have years of experience because they're the ones who saw to the books that were published by the Armed Forces Institute of Pathology, or the AFIP fascicles, and that's Merlinda Caton and Magdalena Silva. They also have a team composed of Ms. Constante and Mr. Christopher, who help with layouts. Our authors are terrific. You can go on our website and see that, and I hope you will. Additionally, we're about to introduce a bunch of comprehensive guides that are supposed to be full tomes to really drill into a topic as opposed to just get started. So just for fun, I'm going to share a couple of cases that are more gastrointestinal pathology. So let me do that. Okay, here we go with a couple of cases to share. Just a few, just kind of for fun and a little bit informal. So here's the first one. These are esophageal biopsies from someone who really enjoyed drinking alcohol and smoking cigarettes. So you can see them right here. And, you know, we're sort of going along, not much going on. And naturally, you see the international sign of the ink dot. And we can take a peek at what's at the ink dot. And of course, there's horrendous looking epithelium. And this is at least high-grade squamous epithelial dysplasia. Okay, so this isn't much of a diagnostic problem. The reason I chose this slide is because of the company that the dysplasia keeps, and that's shown right here. And you can see that there's this interesting break point between very pale squamous epithelium on the right. Let me grab a pointer. And then this odd looking stuff here, and I'll go to higher power. So the odd looking stuff, gosh, has a granular layer, which is not supposed to be present in the esophagus. And that's called epidermoid metaplasia. And in fact, one of our upcoming authors, Dr. Atur Singhi from the University of Pittsburgh, who will be writing on pancreas, has actually written a lot about this topic. Now I'll show something a little more silly and fun. These are biopsies from a patient with a history of Crohn's disease. And this patient was having diarrhea. As you can see, the epithelium looks pretty good, or the mucosa, I should say, in the patient's colon. But let's look at something kind of interesting. So this is not a diagnostic problem, but of course this is intestinal spiroketosis, and it tends to be associated with Brachyspira alborgii. Okay, and you get this sort of fluffy surface with all this fuzz. Feel free to use technical terms, and those represent the organisms. Of course, Dr. Michael Torbenson, who's edited our liver survival guide, has written extensively on this, and it's nice to see his work. The fun part about this organism is that in addition to staining with the Worth Starry stain for spirochetes, which we can see here, nice, it also cross-reacts with the immunohistochemical stain for syphilis. So let me pop that up, and it's really quite striking These organisms are not syphilis. They don't seem to be associated with sexuality, but instead they seem to be more associated with immunosuppression. All right, and here's one last fun case. Again, this is not particularly a diagnostic problem, it's simply striking. This is from a very massive operation performed in a woman who had pseudomyxoma peritonei secondary to an appendiceal mucinous neoplasm. And it's really just quite striking that the pseudomyxoma peritonei, or the mucinous neoplasm, is all over the surface of the spleen. But notice how bland the epithelium looks. And of course, this is quite typical of the appearance of these neoplasms. So that was just kind of for fun. And with that, I end, and thank you very much for your attention. We do hope you'll love our series. We do hope you'll love our books, especially as we expand into the bigger ones. And I know many excellent colleagues have become our authors. Please check our website, www.innovativesciencepress.com, and thank you very much.